Hello, everybody. Hope you're doing well. I want to thank you for taking the time to complete the Health and Science Disparities essay. If you were able to turn that in yesterday, I will have grades and feedback on that assignment by the end of this week. Otherwise, I encourage you to turn that in as soon as possible, since it's minus 5% for each day at Slate. But I do really appreciate you taking the time to think about, develop this project. I'm looking forward to seeing what you've put together. This week, we are transitioning back into a regular Canvas activity. Though as we go to the end of the year, the last assignment that we'll have is the Health and Science campaign essay. So we'll talk more about that next week, but all the remaining assignments in the course are available for you to access from the front page of Canvas. So let's get into our discussion for this week, where we get into issues surrounding health and science policy. So we'll start by looking at the landscape of health and science policy, particularly in the United States, some emergent issues, and the ways in which effective health and science communication engage with these and a variety of other topics. So let's go ahead and get into it. So as we're establishing the importance of thinking about health and science policy, we can think about this in the context of a lot of current events and issues. For example, you might think about some of the issues you identified in your health disparities essays. What were the populations who are being disproportionately hurt or affected by a health issue? And what communication strategies can be used to support people at the margins? We also know that there have been major changes that have significant ramifications for health, particularly thinking about the overturn of Roe versus Wade with the Dobbs decision and its impact on state-level policies with regards to abortion. We know that this has had major ramifications in thinking about a variety of health issues and their relationship to gender. We also know that COVID-19 and its policy issues, including longer-standing protocols, are important areas to explore as well. So organizational and leadership communication is another field that's very concerned with effective communication and engagement on these and a variety of other topics. So as we get into this, you might think about a variety of other current events, concerns, and other issues that are talked about in terms of policy. Healthcare is always one of those things that's very much in the discussion, whether we're talking about Medicare, Medicaid, Social Security, whether we're talking about changes to insurance premiums and the health marketplace. Health policy is in many ways at the forefront of much of our public discourse and debate. So I think it's useful for us to think about some of the ways in which markets have changed in regards to healthcare, the role of bureaucracy, red tape, and some of the challenges. One of them, of course, is the issue of leadership. How can people be brought together effectively in terms of pushing for and advocating for policies surrounding healthcare? How do markets and the interests of consumers shape our understanding of healthcare? One point of concern is that dealing with an aging population who is going to be at the age where Medicare and Social Security will be used, there's concerns about affordability and the long-term impacts of supporting this population. And also decision-making. The process of navigating through bureaucracy, whether it's at the state, the federal, or even the county and local level, can be difficult, and it can require a lot of steps. And over the process of those steps, it can make it harder for people to receive quality care. So thinking about how to do effective decision-making that tries to reduce red tape where possible, while also making the necessary ethical decisions in order to create sound policy is another area of discussion. One thing that has commonly emerged as a system of administering and providing health is what's known as an integrated health center. We have these in the state of Oregon, and they're generally speaking providing a range of health services that are designed to be more competitive. That is, a patient becomes involved in an integrated health center that provides a variety of different forms of support, such as rehabilitation, nursing homes, mental health support, and other means of support. So integrated health is a term that's gained a lot of popularity in recent years and has tried to market itself as providing a range of services that you might not get from a single provider or hospital. So if we're thinking about understanding health communication and how policy issues and structure are playing into this, one way of thinking about this is what's known as the Six Sigma model. That is, health organizations, companies, including Integrated Health, as mentioned, generally create a routine and an effort to try to be as coherent, as organized, as structured, and as waste reducing as possible in terms of defining, measuring, analyzing, improving, and controlling for variables. For example, if there are issues with accessibility and spaces in a hospital, trying to address those. There are issues of burnout and worker satisfaction, trying to create and balance the workload and pay of employees. Additionally, there are workarounds in the healthcare system, ways that various tasks might be accomplished through unorthodox methods, but might create problems in care. We especially notice this in responders and doctors, nurses, and other medical health professionals in the context of COVID-19, who are oftentimes working overtime, working under very difficult conditions, and responding to these changing circumstances, and had a lot of workarounds that were needed in order to support people at this time. Additionally, there's what's known as the lean process method, wherein an effective healthcare organization or company works to minimize problems in the workforce, such as the use of a clear chain of command, organization, and a protocol for addressing potential workplace problems. When it comes to thinking about the administration of healthcare organizations, of providers, and the ways in which these groups communicate, generally speaking, there is what's known as an inverted pyramid model. That is, generally speaking, the patients, right, or the customers are the people that are put at the very top. They're seen as the most important, and providing care and support is put at the highest priority. Hippocratic Oath, do no harm, and so promoting that need at the top is seen as really important. After that, frontline workers, immediate employees who are directly working with their patients, and then supervisors and executives are generally seen as the sort of least of priority in this group, right? So in principle, the inverted pyramid model is used in healthcare organizations to prioritize the needs of the direct patients and the people who work with them. In this way, this model focuses less on profit, but instead on sustainability, on the principles, and the support for patients. Because at the end of the day, a healthcare organization, a hospital, is going to sink or swim based on the way that its patients are treated. So putting decision-making, autonomy, and power at the level of the patients is seen as the most desirable. We've talked about how under a kind of health coaching model, patients get to make decisions about their own health, and providers are able to work with them on that decision-making, rather than a CEO deciding about your health. So this model is seen as representing the values that many healthcare organizations try to work toward. There's also what's known as the Hoyt-Harder model. So what this model suggests is that a leader of healthcare organizations is considering a couple of questions. Does the member of the team or group have a personal stake in the outcome, such as the well-being of the patient? And do they have expertise on the topic? Is this doctor, is this nurse, is this healthcare practitioner able to provide the support that's needed? So organizations tend to suffer when there are executives, CEOs, and other people who are lacking frontline experience, who haven't come directly from the experience of being a doctor or frontline worker, but they have to make decisions that implicate frontline workers. So the concern of being out of touch, especially in stepping into an executive role, is one that is a major cause of concern. That when we look at leadership and organization in healthcare, the ability to be qualified and understanding of the material is crucial. Another thing that guides much of health policy and our understanding of these issues is considering human behavior and motivation, and the way these factors shape the ways in which healthcare is implemented via policy. So one way of thinking about this are the contrasting perspectives of theory X and theory Y. So theory X is an assumption about employees and about behavior, that people are lazy, that people are going to do the absolute minimum amount of work possible, that they're only here to work so that they can put food on the table and get basic needs met. Whereas theory Y believes that people are generally very motivated, they're interested, they want to do a good job. And based on the approach that you take, theory X or theory Y, The way that you treat employees, the way you assume employees might show up to work and express interest in their work in healthcare is going to look very different. Do you motivate and encourage them to do the best job that they can? Or do you recognize through the use of implementing policy that workers are going to put in the minimum amount of work? That's a contrast that these two perspectives offer. There's also what's known as A and B players, where A players in a group like healthcare tend to be positive team players who are willing to work with the group and collaborate, where B players might be toxic or in it for themselves and self-promotion. Additionally, there's the idea of the theory of causation, that rather than being pawns in the machine, people would prefer to be active participants. They want to be involved in their own health, but they also want to be involved as an employee in making decisions about health and about their organization. So empowering people, including at the frontline level, is really important to this too. Similarly, we have what's known as motivation hygiene theory, which argues that people will become motivated to work through motivators, job benefits, their personal relationships, good pay, right? Offering those things, especially with the amount of burnout and challenges in the healthcare field, is seen as important. But hygiene factors, such as lack of good pay, can risk hurting workers and the relationship to organizations. For example, frontline workers and healthcare system in the United States saw significant burnout and turnover in the context of COVID-19. And this theory explains that the variety of factors impacting people's work and their ability to work effectively played a major role in that process. Additionally, it's important to think about how culture and our relationships are going to impact policy and decision-making too. For example, we have to consider the commitment trust theory, which suggests that people use trust for relationships. This goes back to Aristotle's idea of ethos, right? Appeals to credibility, and trusting the healthcare provider, the organization, or group plays a crucial role in the decisions that we're going to make about our health. Trust is also serving as a predictor of the strength of our relationships and connections. That is, if we come to trust the organizations and people we work with, we will likely have stronger healthcare relationships. Training and interactions are crucial to develop culture, including the use of developing relationships. Again, a lot of shows such as Scrubs and Grey's Anatomy, while inaccurate in many respects, develop a sense of workplace culture, and much of these shows is about the workplace culture and background of the employees. So developing and creating a sense of culture, of camaraderie, of support among people in healthcare organizations is a crucial step to addressing issues that might impact organizations, such as the process of burnout. So if we're thinking about how some of these organizations reach publics and reach broader audiences, one of them is to think about the two-way symmetrical communication, people in organizations and larger publics. For example, the OHSU Hospital in Oregon, or the use of medical care centers, or the use of major researchers and organizations such as the Mayo Clinic. The greatest predictor of an organization's success is its character and consistency of its reputation. Can we consistently count on this organization to provide quality care, to provide medical breakthroughs in technology? This is an important element that is oftentimes looked toward. Corporate identity is helping an organization feel recognizable. The image is how we feel about it, and its reputation is how we feel about it in the long term. For example, if you use health insurance or you're involved with companies in the United States, such as Kaiser, right? That term might bring in a very loaded, context based on your own experience in that organization. So the reputation of an organization needs to be connected to its behavior, to its action. So to run and to allow an organization to work effectively, it's needing to have a reputation in line with providing quality care to patients and doing so over a prolonged period. And this, of course, connects closely to issues of public relations, of which we'll have some course offerings in the fall. So as we're thinking about some of these issues, it's important for us to think about the strategies such as organizations like the CDC that manage communication to the public. One of them, of course, is using social media, engaging in social media regularly to talk about some of these issues. linking messages to services that they provide, for example, advertising a healthcare marketplace, and explaining how people are able to receive healthcare, being educational, such as discussing how to wash your hands effectively, using a variety of channels. For example, healthcare organizations and workers have taken to using things like TikTok to share and engage with a younger audience. Updating people through crisis, again, the use of a lot of public communication, broadcasting, technology, and online communication from health experts in the context of COVID-19 was a major concern. One thing that's important in understanding public communication about health is that while there are populations who are directly impacted by health issues, there's also going to be a large population known as the worried well. For instance, a group of people who don't have COVID or might be less at risk if they did catch COVID of its long-term impacts, but are nevertheless concerned. And how do we speak to and support people who might have uncertainty and lack of information about making decisions? The worried well is an important population to consider. Relationships and social media policy are also important, right? How do people act and behave on social media when they're representing the organization, right? If you're familiar with some of the kind of raunchier behavior on Twitter of groups such as organizations like Wendy's, right? Probably not going to fly in a healthcare organization in the same way. In addition, it's important to think about crisis communication. So how do healthcare organizations or groups respond to a major crisis or problem? For example, the Deepwater Horizon oil spill from BP is an example of responding to a crisis, responding to an outbreak, responding to a major case of medical malpractice. These are all things that are important at an organizational level to address fully. So crisis, right, it's an issue that has potentially a really negative outcome that is going to impact the organization and its reputation. Again, BP, British Petroleum, will forever be associated with an oil spill. So crisis management involves communicating with people and how to manage and deal with that situation effectively, how to diffuse the crisis, address the crisis, and make sure that the public is aware, informed, and spoken to clearly about that process. So Deepwater Horizon is an example of poor public communication and public relations in response to this crisis. They were seen as not responding quickly, not taking it seriously, and not showing a clear plan of how to address this issue. So if we're looking at ways to effectively engage in terms of health and science policy and educating the public, one of them is to address and fix the problem right away, right? One of the easiest ways to market and talk about this in a public way is to say, look, you have this problem, but it's been resolved. Using service failures as a springboard for improvement, explaining how the problems or issues that came up are not going to happen again, and developing a plan of action. Recognizing the sacrifices and challenges, for example, of frontline workers and people who immediately responded to the crisis is crucial. Making people satisfied, organized, motivated in this moment of crisis is really important. Sometimes a crisis is not caused by an organization, but an organization is forced to respond to that crisis. They do so quickly, effectively, and clearly. They'll be seen as really gaining a lot of respect in response to that issue. In addition to that, it's important for us to understand the topic of public health, since this is closely connected to policy and how we think about policy. The idea of preventing disease and having a high standard of being across an entire population. Again, COVID-19 was seen as a public health emergency because it impacted the public health and well-being of a larger population. So larger scale efforts and social mobilization are needed, and effective health communication is crucial in order to improve the overall health of individuals in context. When it comes to engaging in crisis and advocating for public health, it's important to be open, right? Sometimes you don't have all the answers, sometimes things are developing, and it's much easier to be clear about your limitations and explain what information is still in the process of being developed, and that level of transparency can benefit reputation within organizations. That is to say that people are less likely to panic when they're well informed. Again, if we think back to the worried well, people are more likely to be supportive and open if they understand and are receiving support from the relevant organizations. In addition to that, there is a subfield in communication studies known as risk communication, which means engaging with audiences that let them make judgments about health safety and the environment. So this is another important factor of engaging in public health communication too. So there are three major populations to consider here. People who are insufficiently concerned. There is, a major virus going on. We need to take this seriously. People who are excessively or overly concerned. These are the things that work. These are the things that don't. This is what's safe. This is what isn't. And helping people who are appropriately concerned function effectively, having the tools and support that they need. Again, at the onset of COVID-19, there were shortages in access to materials such as masks, which identified some of the problems in engaging in effective public communication. So in addition to these ideas, I wanted to make a quick mention to the Bernhardt piece that you'll be working on as part of this week's assignment. Bernhardt piece looks at public health communication, which needs to consider the ecology and locality of public health. In other words, public communication to reach a community or population needs to think about that population, the specific needs and concerns that might impact that community. In other words, public health communication, according to Bernhardt, needs to be focused on the audience. What are the concerns, anxieties, and wishes of that audience, and how can we develop an effective public health strategy to recognize and respond to the needs of those audiences? For instance, the use of town hall meetings or public chat or Q&A has been seen as an effective way to educate the public about these issues more generally. If we look at the US healthcare system, there is a variety of terms relevant here. One of them is the multi-payer model, which means that funding for healthcare tends to come from multiple sources, including the US government. Another concern is the use of electronic medical records. That's an area of health policy and discussion, particularly in the context of viruses, security risks, and other problems in data breaches. Bureaucracy and the level of bureaucracy in the healthcare system can, of course, be a limiting factor in receiving quality care. And it's also notable that many of people in the United States who are filing for bankruptcy do so for medical bills. Again, recognizing we spend a lot of money on healthcare, a lot of people are financially impacted by the healthcare system. And so there's some major ramifications here too. Single payer is a healthcare system that has gained discussion, attention, and debate over the last several years. It's a healthcare system in which there's one financial provider of health, particularly an employer, which might mean that there are better benefits, coverage, but as many point out, it can be expensive and have a high tax burden, and concerns that there are longer waits that people might have in navigating health. So different healthcare models and systems, including comparing the model of the United States to other countries. There's a lot of debate about how healthcare should be changed, in what ways, what impacts, costs, and ramifications healthcare changes might have. So these are useful as a means of framing and overall discussing some of these topics in greater detail. Public option is also something that gained a lot of attention, particularly in the 2010s when the Affordable Care Act was being debated. There was a public option that was added as an amendment, but then removed as the bill went through the motions, which refers to a government-insured plan for healthcare that's generally seen as tied to universal healthcare. That is, in navigating a marketplace or healthcare system, there's a variety of options. One of those options is funded by the government in an effort to try to make that option competitive to other means of healthcare that private companies might be giving. And then lastly, one of the concerns that's often experienced in the United States is that people might stay in suboptimal jobs and programs because that provides better quality of healthcare, recognizing some of the variation in quality of healthcare given based on the organization. So this is an important consideration too when we look at the kinds of care that are being given by groups. So kind of covering that overall landscape of health and science policy, we've outlined some of the major issues, some of the systems and means of organization and health and science policy issues, and a variety of theories that relate to public engagement, how do we engage with the public, how do organizations and healthcare workers engage with the public too, that are all useful as we're thinking about these and a variety of other policy issues. So next week, we are diving into health and science campaigns. So thank you again for working on your disparities essays. I look forward to reading through those. Your final major essay in the course will be your health and science campaign assignment, where you'll be looking at a major health and science campaign. And we'll be getting into that content in more detail next week. I hope that you all have a great week. I look forward to talking with you again next Monday. Have a good one.